Ladies and gentlemen, thank you for your time. Next up in the lobby, we have the panel discussion on empowering women in healthcare leadership, driving change and innovation. First up, will you please invite Ms. Ayushi up on stage to give her remarks. Thank you.
Hi, good morning, everyone. I welcome you to our session on empowering women in healthcare leadership. Just by way of introduction, I'm Ayushi Agnihotri. I'm leading fundraising and advocacy work at Foundation at FIND, which is a global nonprofit that's headquartered in Geneva. And we aim to address diagnostic gaps for low and middle-income countries through R&D and ensuring access to diagnostics in these target settings. I graduated from the LKY school in 2011, so it's really nice to come back to the school and do this here. So I'm hoping that we can have an interesting conversation and discussion today. We have our esteemed panelists who are here who will be very happy to share their experiences with you. Just by way of introducing the panel, I mean, as most of these panels have been done so many times, we approached today's discussion with a lot of apprehension, more from myself. This has been discussed over and over again, and it would just turn into yet another discussion on inequalities in healthcare and now improving access for women to leadership roles. But as we delved deeper into this discussion, we all realized that as trite as the message is, it needs to be brought home over and over again because progress has been made, but gaps still remain. And we're hoping that today's discussion is not just about highlighting some of those inequities, but really drawing on personal experiences of our panelists and their unique perspectives. They've all had very different kinds of journeys, things that have worked for them, things that have not. So I'm hoping that we can bring that dimension for us to really delve deeper and take home some key messages and lessons from this session. And I think as we proceed with today's panel discussion, the idea is we'll have the first 30 minutes for the panelists to answer some questions that we have prepared. We also have a presentation that will be made first, and then we have around 30 minutes for a Q&A session. And I'm hoping that all of you will participate actively in that session and really draw on the experience of our panelists. As we bring the panelists on the stage, we will ensure that they make their own introductions so you can hear their journeys in their own words. So first up, we'll call Ms. Sarah Wong, who is a venture partner at Health Venture Labs. We will also be hearing from Ms. Janice Wang, who is the Deputy Director at the Ministry of Health, Office of Healthcare Transformation, and Ms. Ravani Chandrasekhar, who is an independent health security consultant. I'm hoping that we can have an active participation and you can take back some new nuggets of information and experience. Thank you so much for being here today. Sarah, if you could just come up. Thank you.
All right. I guess you can hear me fine. Hi, afternoon, everyone. My name is Sarah Wong, and oh dear, the last line of my slide is cut off, but it reads venture partner at Heal Venture Lab, which is a regional health tech accelerator. I'm there working as a consultant, and basically I work with startups to help with their advisory, go-to-market kind of work, and also help with investor acquisition, so looking for money for them. My background is, I'm not a doctor, I'm not a bioengineer, I don't have a PhD. So my background is I'm an econ student, and I found my way into healthcare in a corporate innovation lab in Medtronic in the, when maybe 15 years ago. That was when digital health was really starting to take off, and I was really excited. Literally, the App Store opened up 1 year ago, and 1 year before I joined, and the team that I was in was tasked with looking at digital health solutions to help push the products. So that was my entrance into healthcare, and since then I've taken on different roles as a product manager. I was most recently in a startup turned unicorn in the US, where I was doing different things from customer success to the last role, which was value engineering, which was essentially helping customers understand what was the value of using these tech solutions to reduce healthcare spend or quality. And I was tasked with the team to help quantify, like, okay, how much dollars were we actually moving the needle by for our customers. So yeah, that was a great experience in the startup space in the US, well, Silicon Valley. And so now I am in Singapore and advocating very much for women in healthcare leadership. I have a podcast about working moms. It's called Make It Work. So please smash that subscribe button. But without further ado, I wanted to share 3 actionable ideas in light of us being at a festival of ideas that I think are very actionable, and it's all from my own experience of what I feel has worked for pushing and empowering and driving change, basically, to help women access more leadership positions in healthcare. So I need this clicker. Yeah, let's try. Okay. So first idea is to network. I think research has shown that the biggest way for women to access more senior leadership roles as they grow in corporate especially is to engage in networking behaviors. So with that, really, it's about accessing these different groups that are available. And if there's one that's available in your company or in your organization, I would say join it. If there isn't, start one. I was the first female hire in my startup in the US, and I was also the first person who had to activate a maternity policy. In fact, it was written for me. And when that happened, I was like, oh, there's probably a whole lot of different kind of, female-friendly or family, centric kind of policies that aren't written in the HR manual when I joined. So I was one of the first 2 people to start a women's initiative in my previous company. And that has paved the way for the 1,000 other employees who joined essentially after I did. And I didn't know that right at the start. I was just, I need maternity, and my company doesn't have it, so let's go and find out a way to do that. So that's one, to join one or to start one, and also to be one. I think that's the piece that I'd like to really highlight, that we all have influence in our little circles and little spheres wherever we are working. And it's as easy as basically telling another woman about an event like this. So one of the reasons why one of my friends is here is because I put out this event in a women's group that I've joined. And I know quite a lot of women's groups right now in Singapore, so if you are looking for any to join, please come and talk to me after this. And with that group has also been super active in pushing other events. And I think that's just one great thing in joining groups and networks, to be able to essentially tell other people. And I think there's so much to be said about women coming together and helping each other. There's this interesting illustration that I read in a book which I will share in a resource page later. It's called Gender Goggles. And when men come together in a group, they're always trying to compete with each other. But when women join, they're always trying to basically, the way that they invite other people in is through weakness, rather than, hey, let me whoop your ass. It's like, hey, I'm not really good at this game anyway, so just join and play this game with me. So when women come together, there's a lot of validation, a lot of solidarity, and a lot of inspiration. So I think that probably gives reason for that research data point that I shared earlier. So yes, first point, network. The second point would be, to just speak up. And I think being here is an example of speaking up. The last word at the bottom is self-agency, and that's one piece that I think we probably think we don't have, or rather we underestimate the amount of self-agency we have. And I want to share 2 examples of how I just leaned into my own space and spoke up in different circumstances. So one was for unconscious biases. So I was in my previous company where I was a bit of a minority, like I said, female, young, first female hire, and I constantly found myself in this meeting where a male manager would be speaking over me, and not just me. I felt that he was doing it with other younger women, and I wasn't sure if it was just me being oversensitive. In fact, this was my first brush with something like that. And what happened was I spoke to other people. I spoke to my male manager who was also in the meeting to double check if that I wasn't crazy. And finally, we decided that, yeah, it's probably a pattern and let's talk to HR. So what happened after that was there was some process that happened. And shortly after, that male manager who, the one who was speaking over the women, his behavior changed 180 degrees. And I was just shocked. I wasn't sure what to expect. But what I heard was that he had no idea he was doing it. So I realized that having kind of taken the first step to try to, put the unseen seen was really helpful in that case. Another one was helping with leadership, increasing the leadership funnel for women. So I wasn't, in a super senior role, but in my team, I was going to hire for data analysts. And all the CVs that came by were good, until I noticed that for every one female CV that was coming for the data analysts, there were 6 to 7 male CVs. And that raised a red flag in me. I was thinking, why didn't HR even notice this? But what happened was I then worked with HR to say, hey, come on, man, you need to give me more females. It's just going to perpetuate the kind of inequality, right? So that was one thing that really helped, and that increased the female intake by 30%, and eventually we hired quite an equal number of male and female just by meritocracy, just by doing the data tests and having the qualitative rounds. And so I was very pleased with the outcome from that. So yeah, the second point would be to really try to speak up in your own sphere. You don't need to be a CEO or HR person, but just do small things to move the needle where you are. All right, so the last piece is about rethinking the village. So I speak here as a young mom of 2 kids, and as a woman progresses and grows, there are different needs that need to be taken into account if she still wants to continue working. So we all heard that it takes a village to raise a child. But what does it mean in the modern context? Well, right here and right now, I think a lot of it is not just government giving us handouts to live close to our parents, but it's also the employers, right? The employers have a huge part to play. We spend so much time at work, and what we need to see is employers taking a bit more of an active step in building that village. It's not just for your helpers or grandparents. It's a total community. So with that, I want to talk about these 3 different things. And one of the interesting data points that I found about this was from this platform called Moxy, M-O-X-Y, which is a local platform that aggregates anonymous data of data of corporates in Singapore and in Asia to understand how women-friendly their corporate policies are. One of the data points is that only 2 out of 5 women are actually comfortable to talk about flexible working arrangements at work. So why is that, right? It's probably some kind of structural barriers happening over there. I'm glad that the government is moving towards allowing more of these flexible arrangements and welcoming such conversations. So I think we are definitely moving in the right step. Though when I think about a recent conversation I had with my sister, she works in Australia, it makes me still wonder how far we are. So she has a boss who works 3 days a week. She's a woman, a female boss. And I asked, hey, do you think when you work for a female boss or someone who works 3 days a week that this person is any less committed? Because that's at the back of my mind. I think that's what the employers are also wondering. And she said, No, in fact, it shows me that she's much more capable to actually be able to be at the position she is and still do the good work that basically she needs to do. It shows me that she's more productive. It shows me that the company also values people who have such working arrangements. So that was a really good food for thought for me as I thought about basically the idea of what does a flex work arrangement have in the larger organization and how it's viewed. I'll just talk about the last piece about shared parental leave. I think that's also something that our new Prime Minister also talked about at NDP, and I want to say that that's really important. One of the interesting things I noticed when I was back in the US was, whilst we were trying to build out those family policies in my company, in the team that I was talking about, the women's team, was that we found a whole a Google sheet that actually documented different companies in the US having, and their kind of family leave policies. And so it was very transparent, and I think that's one thing that can be definitely worked on if we support the likes of a Moxie, for example, because that's what they're trying to do. So keeping things transparent and helping others to rethink village. So with that, these are some of the resources that I mentioned earlier on, and also my QR code for us to connect. Happy to have conversations after this. Thank you so much.
Just get onto the stage. Thank you, Sarah, for the very thoughtful presentation. What I missed as part of my introduction is that I'm also one of the co-founding members of Women in Global Health Singapore chapter. We have a few members here as well. And this sort of session is also brought to you by sort of the Women in Global Health Singapore chapter. We can share more information, but if you Google, you'll find most of it here. We have Anita and Marie, who are also co-founding members with us here in the room. So in case you want to have a conversation and rethink the village, as Sarah said. What I'll do is now, maybe it'll be good for us to just have a quick introduction with Janice and with Ruvani. So Janice, do you want to start?
Yeah, hi. Afternoon, everyone. I'm Janice. I work in the Ministry of Health in a small incubation unit where we do transformation work for the healthcare sector. So just maybe a quick description of my career journey. So I started off in the social services sector. I worked in a lead agency called National Council of Social Service. So it's a female-dominated industry, right, social services. So that was my early career experience. I think I had slightly maybe different experience from Sarah. There were some male leaders as well as many, many female leaders. I think personally, I didn't quite notice a difference in the styles of the male leaders compared to female leaders. Maybe because it attracted a certain type of profile of people, right? People who tend towards patience and compassion. And my story though of the challenges that I had in that industry is, I think personally, I'm probably more of a male spirit myself. I probably have more of the male energy, right, in the way that I approach work. And I think that when I started off as a young, very enthusiastic, wanting to change the world type person, I was an alumni in LKY that contributed to me wanting to change the world. But I kind of was, all gunning towards making a difference in the work that I do. I think that kind of rubbed off in different ways for people in the sector and people in the industry and people in the workplace, right? And I think one thing that I remembered when I was a junior worker, my deputy CEO then, right, was okay, Janice, it was during our roundtable, right, our appraisal time, and she's okay, you have great potential to be in leadership position, but one thing perhaps that you could work on is your communication skills. how do you work well with others? And I think that was a very, to me, a pivotal moment in my early career. It wasn't about the fact that I was a female. It wasn't about the fact that I was a junior member. I think I appreciated the fact that, it was a female leader. She brought to my attention that, it's not about your career aspirations, right? You can aspire to whatever you want to as a female, especially in Singapore. The barriers, I believe, are slightly lower compared to many other countries. But still, in the workplace, if you do want to rise to leadership positions, there are a few general principles that we probably should remember, which is to communicate well, to work well with others, teamwork, and managing expectations. I think these are all general skills and knowledge that was imparted to me in my earlier career. And then I went to the dark side. After staying some time in social services, I switched all the way to for-profit consulting. So I was a management consultant, and then I went into tech consulting. So I went from a very, very female-dominated industry all the way to a male-dominated industry. And that really took me a while to get used to, especially when I first went into management consulting and then tech consulting. But by the time I went to tech consulting, I kind of got used a little bit to the whole working for money and some of this drinking culture. But that's very, very true, I feel, in tech consulting. It's male-dominated, and they go for smoke breaks, they go for drinking, and there's bro hanging out, those are all part and parcel of the subculture. Not something that I think I naturally am inclined towards, but I thought about it when during this session, and did I manage to overcome some of these practices that maybe is not my norm? I did not, right? I participated in them because I wanted to find opportunities as well, many others, right? And so I think it's a balance in the setting that we are in. What does it mean to succeed? What does it mean to do well in your job? I think all this needs to be kind of calibrated according to where you are. And then right now I'm in healthcare. Again, I think it's there's a lot of female workforce in the entire healthcare industry. If you think about the nurses, the care assistants. But primarily, if you look at the key roles like doctors, it's still male-dominated, right? And CEOs of hospitals and of lead ministry agencies, these are all male-dominated roles. I take the approach generally as I am, which is that no ceiling is too high for me to break, right? And that's how I kind of take with me that spirit. I think right now I do innovation work, so generally it requires a little bit more creativity in the type of work that we do, which I think kind of works well for females. We tend to bring to the table a lot more collaborative spirit, a lot more creativity into the job. So with that, I think that there is an equal opportunity for both males and females in the healthcare sector.
Thank you so much, Janice. And I think she brought in a very important point about context and setting. I mean, different people in different settings with the same set of skills could sort of define success and move forward in different ways. So thanks, Janice, for that very important and key point. Ravani, maybe if you could just start with your introduction and then also sort of speak a little bit about your journey and biases, challenges you may have faced. And if you could also just add a little bit flavor with the context and how it was either instrumental or detrimental in where you are today in your career.
All right. Hi, everyone. I'm Ravani Chandrasekhara. So I am a consultant in global health security. And in case you're wondering what global health security is, it's working on activities, policies, systems to prevent, detect, and respond to health threats. And this is usually in the pandemic preparedness space, but it doesn't necessarily have to be, but that's where you see a lot of the effort. So in terms of background, I entered the workforce in a military environment, working in a civilian position, but in a military environment in the US Department of Defense. And I was doing program management for infectious diseases. And then I later transitioned to do more policy work on global health security issues with the US Department of Health. So starting in the US military environment and being like a young woman, if we're talking about challenges at the time, so I was an introverted individual. I entered this male-dominated situation. But I have to say, like, I had amazing colleagues. So even though it was male-dominated, I had opportunities to grow, and I think it's very instrumental, the type of leadership you have, who are looking out for you and wanting to pull you up as well. So I feel like those are some of the things early on that really helped me. And then as I transitioned to the policy environment, I worked with brilliant, engaging women who had worked super hard throughout their lives to get to the position that they were in. And I would say it's positive in that it opened a lot of doors, but challenging in that because of some of the things that the people who came before you had to endure, they had such high standards, so they hold others to those same high standards, and sometimes it can be a little bit challenging working in those environments. When I think back to what college was like, I went to graduate school in public health almost 15 years ago now. The class was predominantly women, and I could count on my hands the number of male colleagues that we had in class. So it's interesting that even after 15 years, we still see that the workspace is still not, you don't see as many women in those top leadership positions. Mm-hmm. That said, I will say over my relatively short career that I have seen improvements over time. When I first joined the workforce with the US military, there was, it was still not okay to be openly LGBTQI and be in the military. And that changed shortly afterwards. When I first gave birth to my first child 6-7 years ago, there was no paid parental leave. I had, and this was with the US government, right? So we got some sick leave and then to recover from your, the ordeal of giving birth to a child. And then if you wanted more time, you had to take unpaid time off. By the time I had my second child, a couple years afterwards, there was at least a law within the US federal government which allowed me to take some time off, paid time off. And it applied to both parents in the case. So what I would say, like ending my introduction here, is yes, there's a long way for us to go, but we have had incremental change over the last 15 years.
Thank you, Ravani. And I think we brought in a very important point about the spectrum. I think it's not just about men and women, but also allowing for equal representation across the spectrum, and just for people to feel confident that they can progress and get into leadership roles despite where they are. And I think that's very important for us to keep reminding ourselves that it's not just about women speaking up, but it's also allowing everyone that equal participation. So moving on sort of from there, Sarah, we heard a lot about sort of the three big ideas that you had on how women can sort of improve their participation or leadership. In terms of like, are there specific skills and competencies that you've experienced or built over time that you feel were invaluable to you as you navigated your career? Yes.
Yeah, I think one of the biggest ones is being able to network, or back to idea one, which is to be an effective networker. I realize it's not just having a big like LinkedIn connection, but it's thinking about listening to understand before trying to be understood. And when I say this, I think of an example where I had this great male ally, and he was a mentor in my previous company, who he would actually sit in my meetings, my Zoom meetings, to give me feedback on my presentation, because that was one thing I wanted to improve on. And he's so senior, like he's been, CMO in various companies in the US, and I was just a pretty junior person. I was thinking, how do I kind of give back? And so I asked him a simple question like, hey, what's top of your mind this week in one of those one-on-ones I had with him? And he said, I'm going through this leadership challenge with some people. These are the areas that, I'm really trying to think of good ways to have difficult conversations. And so with that, I, went to look out for some articles and things like that, and I just passed it on to him, which eventually was helpful. So I think that is one piece, to learn to give back and think of interesting ways to also connect beyond just trying to, advance your own agenda, but really learn to see how other people are also all navigating different challenges in their own spheres that you might be able to help connect or have resources to help.
Thank you, Sarah. And I think that's one key part as well as and also my own experience, that as you move up, it's not just about people watching out for you and pushing you into leadership roles, but what do you do when you move up? And I think I had this chat also with Anita recently, where she was talking about moving forward in leadership and really bringing the team along with you, or the people you're surrounded by with you in that leadership journey. So that's a very important key point, Sarah. Thank you so much. Janice, do you have any special nuggets, competencies that you would want to highlight? These are the one or two things that I feel which are very unique to you and your leadership style.
Yeah, I completely agree with Sarah's pointers. I think relationship to me is like relationship building skills is to me like the number one key skill if you have aspiration to do well in the workplace. I think competency aside, right, you have to kind of be good in what you do and kind of enjoy what you do. But that's a lot about understanding yourself. I feel like the awareness of understanding your own strength, how do you work on it, build on it, I think that's also priority. But one thing I would share of how I think I was helped in my own career is that I'm generally quite a helpful person. I kind of like to help others, but I took that in kind of full spirit in the workplace, right? So what that means is pretty much no matter which department you are in, no matter whether you're a junior worker or like you're senior management staff, like if there's something that you need help in and that you approach me for help, like most times to not, I would say yes to it, even if my plate is pretty full at that point in time. Like I'll figure out a way to make it work. And I mean, interesting enough, I think that's been quite helpful. Of course, learning to say no is very, very important. So like that's still a key skill, right? But in this context, then, like it's not just about relationship building, but that reputation that you build as someone who can be trusted in the workplace. I think that's invaluable because how it works in Singapore public sector, not very sure how many government people are here, but there's in every appraisal, you sit at a round table, right? And everyone goes through a bell curve, right? In case, people don't understand the Singapore system, like there's a bell curve and, the entire organization is rated A, B, C, or D, and it affects like your pay, your like bonus, and to some extent your promotion opportunities, right? And in this roundtable, it's not just your boss or your supervisor's words that matter. Like everyone in the roundtable, right? So it could be like a supervisor in another team, or like someone that you have worked with, or like anyone else in the organization would have a say to what they think your potential is. And in this circumstance, I think it kind of drives certain type of behavior. So organizational culture, I think, matters, right? So it kind of makes you a little bit aware of needing to work with others, building good relationship throughout the organization. I think these are all bits and pieces of advice maybe that I have. Yeah.
Perfect. Thanks, Janice. Ruvani, do you have anything additional that you would want to?
So I think I'm actually going to just echo both of them because networking definitely is something that I have had to learn to do over time. I haven't, and honestly, it's still a work in progress for me figuring out how to do it. If I think about networking early in my career, it was one of the most awkward experiences of my life. I went to networking events because I figured it's an expectation to be there, and if I go there, then I'll get something out of it. So it's taken me a while to figure out what networking means to me. And for me, what has worked well is establishing a rapport with someone who understands what I bring to the table, and then leaning on them to help open those doors. What I will say, though, is that when you're approaching these mentorship or networking opportunities, there is no, I think we can all agree that we should all be there to help and lift one another up, but you cannot go in with the expectation that someone is going to do that for you. They have the right to say no. They have no obligations to you. So when you approach it, you cannot go into it just expecting something back. And then that one or two times when you connect or meet with that super networker, when they're genuinely helping you because of what you bring to the table, it opens up so many doors for you. And honestly, I think the reason why I'm even sitting on the panel here today is because of some of those opportunities that have happened previously. So there's that. And then for the introverts in the room, I am a fellow introvert. And that's another piece that I've had to figure out and work through over time, because the perception of what an introvert is in the workplace is sometimes, it can be very negative, that maybe they're not smart enough, they're too shy, and that's not necessarily the case. I think first you have to get over that barrier to think that being introverted means not intelligent. Like, that's not the case. And to overcome that, one of the things that I've done is to become a little bit more smarter on different subjects, so that when I am in a space where so I have an opinion that that is worthwhile sharing. Mm-hmm. Most of the time when I don't tend to speak for the sake of speaking. Mm-hmm. If I say something, it's because I want it to be something meaningful and impactful. But to get to that point, you have to put in the effort to be curious. Mm-hmm. So, yeah, I'll stop.
Perfect. That's great, Romani. And as a fellow introvert myself, I feel that we constantly feel, and maybe I don't know if it's more a feminine trait, that we try to reserve our opinions and input to the point where we feel it has to be only expressed if it's taking a conversation forward, really contributing to it. And there are times when someone else would say, and they will just sort of take that presence. And during a course that I've just recently taken on leadership, and it was tailored for women, what they told us is that everyone has a unique style, and it's how over time you need to find comfort in that style. So that's where your confidence and your ability to sort of really take that role that you're given and sort of be present as a leader is important. So it's not, there is just one model of leadership, and I think as things are progressing and evolving and more women are participating in workforce, there is an evolution of what the perception of success in a true leader looks like. So I think, as we have all alluded, that significant progress has been made, and we're hoping that we can continue to sort of inch forward on that. And I think we all spoke a little bit about mentorship. What would be super helpful is to specific strategies that you may have used to find a mentor for yourself. And I think Ruvani touched on that a little bit. But Sarah, if you have had any experience, and I know everyone in the room here has at some point had a mentor or a champion who supported you advance your career. Mm-hmm. So if you have a specific example that we could all sort of learn from, that would be super helpful.
Yeah, of how we've found mentors
Yes.
in our lives. Yeah, so I'll go back to that example of the male ally / mentor in my company. It was through the women's initiative that me and my other female colleagues started in the tech company, and I think that's the other piece about how to empower women. It's about finding allies. So he was someone who was a big advocate for helping to be a voice for the other women. And so it was a formal program, essentially, that we had where there would be mentors in the company. And it was something that's really ground up. It wasn't even HR initiated. We just had a few women, and we decided that, hey, let's look for some maybe more senior folks in the company who would be happy to be matched to someone who was more junior in the company. And so that was the women's mentor program that we did. And yeah, he essentially would meet regularly with me. And I think one of the big important things that I learned out of a few other mentor programs that I've been through, but this one was very, very significant in my career, was I think because he was very specific about how he could help. And because of that, I knew I had to come into each meeting with specific asks about areas I wanted to grow. So I shared earlier that one of the things was me being pretty insecure about my presentations. And the amazing thing was that he didn't just give me his how I would do it kind of perspective, but he sat in my presentations, even though he wasn't an actual stakeholder in it, but he showed me that he was walking the talk, and that really inspired me. And to this day, we still keep in touch, even though he's away. And he recently reached out because he's looking to hire for APAC, like a leader in this space. So I'm so glad that that relationship has sort of blossomed and evolved in this way. But yeah, if not for that program in my company, or I wouldn't have met such a great mentor who gave me a true sense of what it looks like to walk the talk.
Mm-hmm, mm-hmm. Thank you, Sarah. I think the mentorship is such a special relationship, and I've had mentors, people who've been like from start to end to this point in my career, who at different points in my career I've helped come in, answer some questions, and also sort of hold a mirror to my face to say, this is why it's happening, because of that long-term relationship. So it's about seeking and retaining that mentor as well over time. And not that you need to have a mentor through your career, the same person, but you may also need different people at different time points in your career based on where you are. So just coming back to you, Janice, do you have any specific examples where you sought out a mentor or managed to get one and have been able to use him or her in your career?
Yeah, I probably have an unpopular opinion.
Uh-huh.
Like I've kind of participated in a couple of like structured mentoring programs. I mean, more of it is with LKY school, and one of it is in the workplace, right? And I personally didn't find that the structured programs worked because the pairing of the mentor with me was artificial, right? They didn't know who I was. I didn't know who they were. There was no trust in that relationship. And it was pure, advice that they gave that could be read in a book, So that's my unpopular opinion, that structured stranger-type matching programs may not work as well as we think that they will. But I have to say, though, I'm totally a proponent for finding people who are able to guide you in life, at work, and giving you good advice in general. I've personally benefited a lot in my career from having such people in my life. I mean, that's actually how I found my jobs, all my jobs actually, beyond the first one. It was actually through networking. But it was not networking because I'm also like an extreme introvert. So I think we have four seats of introverted females. But so I don't actually go for networking events. It's not my thing. But what I think helps is kind of meeting people one-on-one. That works for me. And at work, especially if there's a person that I feel is a good role model for me, then I would go the extra step to build a relationship with him or her. And I think it's that time frame that matters, right? When you know someone long enough, when that person knows you long enough, there's trust built. And I think that trust is where then they would go that step forward to tell you something, right? Like you said, right? Put the mirror in front of your face to tell you things that you might not like to hear, or who would be the ones who would give you like a job opportunity because they trust that you would not make them lose face, right, in the Singaporean context. So that's my...
That's super helpful, Janice, and also sort of brings home the point that there could be several attempts of finding the mentor, the right person who can guide you, but you may not succeed in the first round, the second round. It's more about sort of trying to interact with different people, learning from them, and taking sort of input across that, and then finding that one or two people around you who can really help. Maybe switching gears a little bit, Ravani, is there is a lot of conversation around reimagining how the workplaces are designed and the infrastructure and the flexibility, and particularly after COVID, it's a very topical, pertinent conversation. There are offices which have gone back to full work from office mode. There are who are in between a hybrid model, and there are who've gone sort of fully sort of online. Where do you think is the most value that can be brought into ensuring equitable participation in the workforce across sort of the different sexes, genders, whatever's the right word, yeah.
So I think a lot of this is dependent on the type of sector as well. From my experience being in government and health, COVID actually moved things for me in a positive direction because it forced the government to go to an arrangement that it probably would have taken 10, 15 years to get to, like the flexible working arrangements. There is a lot of work that we do in the health policy space that doesn't have to be like everybody has to be working on top of things all the time. So I think there's a lot of room there for the flexible working arrangements to accommodate this wide variety of talent that you really want to tap into. There are certain aspects, so I also work in emergency management, and emergency management, there is no off switch when there is an emergency, right? And so for that, it becomes a little bit more difficult to be accommodating of some of the arrangements people have come to expect. And I know that people who work in this space also find it challenging now to retain talent because of the new expectations people have around what a working arrangement looks like. That said, also from the US context, there is no support system. Like when you compare to most places in South and Southeast Asia, there is no support system around you. Even here, I know people struggle, even when you have your relatives nearby or your grandparents who are willing to help, or anyway, help. I was trying to think if there was the politically correct term. Helpers to assist you with things. This is part of the reason why I think I've made the choice to do the type of work I do right now, because for what is important for me in my family context, I want to have some of those flexibilities. I want to, for me to be able to engage in the type of interesting work that I want to be, I need to have a little bit more of a structure around me, and which is very difficult for me to do in the US right now. So I think there are cultural differences in different parts of the world. It would have to be an ongoing conversation. My husband, who works in tech right now, was just telling me how in his workplace, they're all expected to go full-time to work in the office 9 to 5, beginning of next year. So we're going to see this shift going back and forth. The expectations of what people have are going to also change over time, and accommodating the different generations. There is something to be said about each generation has different expectations, millennials, Gen Z, Gen X, whatever the case may be. And I think the only way to manage those is to have everyone at the table to figure out what works, and then do it alongside the business case for it. Otherwise, it's not going to be sustainable.
That's very interesting, Rumani. And I think the flexibility is something that's seen as largely helping, but also if you're getting into leadership roles, and I've had a bit of that journey over the past 5 years, where I've moved from reporting to someone in Geneva to now leading a team in Geneva and still having that reporting line. I do have that flexibility in the mornings to do more stuff, but then the evenings I need to be available to do that, and that's possible in Singapore because of a very unique infrastructure around me with as a mother, somebody who needs to take care of my child, there has to be dinner prep. So I think going back to also what Sarah said, you need to reimagine the village and rethink on how people can really support. But what I've seen is that over the 5 years has been so much support, and that has really helped me get into that role and do justice to it. So I think, and there are more and more people who are able to do it across time zones, and I think it's been helpful to advance the cause. I think, Sarah, you talked about, yeah, sorry, go ahead.
I was just going to chime in about this piece of reimagining the village where there's the hardware piece, the structural stuff of getting, flexible policies. There are also a lot of soft pieces that a lot of the times are barriers that we rightly or wrongly place on ourselves. So I think about another example. It was a guest that I had on the podcast who worked in a very forward company, LinkedIn, and she had just gone back to work after having her kid and was trying to figure out how to work out the schedule because she used to have a 9 a.m., but now she's always pumping, so she couldn't make for the 9 a.m., and she was so afraid to tell her boss because she had a mentor in the company or someone else who had been there before. It gave her the license, the mentor gave her the license to ask for what she needed, and this is not like written anywhere, right? It's just more of building out a culture where it's okay to ask for changes around a new life stage. Another example was this McKinsey consultant who, when she was pregnant, she actually told her clients before anyone else that she was pregnant because it was affecting her work, and she didn't want it to be on her in that, like, oh, she's not pulling her weight again. And it was because there was this kind of psychological safety, I suppose, and that culture where it was a client who's like, oh, that's great, you don't need to travel so much anymore. That provides a lot of these small incremental, these are the smallest things really that can be a rule or a policy in the HR manual that also fosters the environment, right, that is friendly to women in a different stage.
Thanks, Sarah. But Janice, I mean, from a public sector perspective, how is sort of the government responding to this need for flexibility? Is there something that you see is shifting? Is it changing, or is it going back to the same? Has there been a disruption during and after COVID in sort of the government?
I don't speak.
Yeah, I mean, just your, yeah.
Janice. But definitely, I think the pandemic changed many things. I mean, I think I speak maybe for the introverts. Like, the pandemic was great in many ways. I never felt more productive in my life than the last 3 years, and not more happy, right? Never not more happy. But maybe I'll share a few of things that I did. I actually took no pay leave when I was in consulting because I was suffering from burnout. And I felt like I needed to reinvent myself, right? I mean, that's the type of thing that I feel is very prominent in the consulting space. But I kind of took the leap of faith, right? I took a no-pay leave for a couple of months. Maybe a large part of me felt that because I took it and I came back refreshed, right? And I felt a lot more productive as a result. And I think it benefited a lot to the workplace. And I feel like maybe it's not so much, to me, a gender thing, but I think workplaces ought to kind of look at productivity in more measures than what we see now, right? It's just kind of you working, your butts off, right? However long of a time, and that's what you're measured against. But we don't take things into account like mental wellness, mental health. I think these are things which affect our workplace performance in more ways than just clocking the hours might do. And could we support people who might want to take no pay leave and kind of still provide them with that financial benefit, or like job security such that their career is not impeded as a result of taking that break, which might be helpful, right? And another maybe story that I will share is I did hear of one workplace, shall not name the workplace, but I overheard that in the performance appraisal, there are obviously females who gave birth, right, during the year's period. And it was talked about that, perhaps the candidates who went on maternity leave during that year period should not be given that promotion opportunity, or should not be given a good rating compared to the peers who kind of worked the full year, right? So it was kind of like you work for 12 months in a year versus you work for 8 months of the year type of comparison, right? And I must say, from a logical perspective, there is some sense in it, right? If you think about it from a bell curve, there's only this many promotion opportunities that they can give. There's only this many A's, right, that they can give every year. So with that, few A position, how do you compare someone who has worked 12 months in a year versus someone who put in 8 months in a year? So there's some sense in that. But in many ways, I think that, definitely from a female perspective, we would feel quite aggrieved from this conversation, right? And that's what I felt. That was my natural emotions to it, right? Feeling that this should not be the case. But I'm not too sure if workplaces themselves can resolve this. I think it's a public policy issue, right? How do we set the expectation and the standards as a nation? What are some of the policies that the government can put in place, right? Not strict policies, but guidelines and norms that we should try to build as culture, such that we don't have to be like the Scandinavian countries where they get 3 years of paid leave, but could we then inch a little bit closer to what it looks like for females to, it's hard work, right, to contribute to the birth rates. Could we then be still recognized for this effort that we're giving to the nation? Yeah.
Yeah, that's a very pertinent point, Janice. And I think that's the debate that's happening as well now. How do we restructure, really break down the traditional ways of working, which were set up at a time, and things have changed, but do we need more intervention? Do we need more sort of instruments to help shift it faster, at a faster rate, and especially for countries which are struggling with birth rate issues like Singapore? Anyways, it's very interesting points of view. Would now I want to open the floor for any specific questions to our panelists. There we have one here.
Hello everyone, thank you very much for your presentation and the panel talk. My name is Danagul, I'm from Kazakhstan. I'm doing research similar on empowering women in leadership position, but in civil service in Kazakhstan. So my question is more about the government intervention. So you touched the topic a little bit, how during the COVID they changed the flexible arrangement and so on. From your personal experience, what other recommendation you can do for the government, or there is no need for government intervention and the companies or women itself can change anything in their companies? Thank you.
Do you want to start?
Okay, I can start. So again, I come at this with a US lens. So US has 3 bodies of government, basically, right? You have the congressional piece, the executive, which is like the White House, and then you have the agencies that actually implement things. For some of these flexible working arrangement, or those tend to be managed by the agencies themselves. And oh, I should caveat this. I'm not a U.S. government employee. Please don't take anything that I'm saying as U.S. government. I'm just basing this on my experience. For some issues, and I'm thinking back now to the paid parental leave, for example, those are things that need to come from the congressional branch, because without that, you're just not going to make progress. In places like the US, it's further complicated because you do have federal law which oversees states, but then state law has a lot of authority, I guess, if you will, in dictating how things are run. So to implement any sort of policy change, make a shift in the culture, in society, all three branches need to be engaged. And I don't know how that translates to other countries in Kazakhstan, but I think approaching the problem knowing that you have to tackle all three is key.
Mm-hmm. Sarah, Janice, do you have?
Yeah, I mean, I definitely think like it needs like the full participation of society, right? Not just government responsibility, but I think it needs to be set in the cultural context. I feel like, you know, it was just not so long ago that in our parents' generation, like it was the norm for like the mothers to stay home and be homemakers, right? Like in my parents' generation at least. And I feel like that context, you know, depending on where Kazakhstan is in your level of social and economic development, I think certain policies may need to move in tandem. I definitely don't subscribe to Western ideology being the best all the time, right? I feel like there are many good things about Central Asia, about Asian cultures that ought to be preserved based on the norms at that point in time.
Mm-hmm. Yeah, I chime in where context and cultural norms are really important. So we need to essentially find out where are the women in Kazakhstan facing the biggest dearth of support, because that's where we're talking about government, right? Where do they come in to plug in those gaps? So in Singapore, we have great childcare support. Maybe that's something that isn't the case, and it's a very unique thing. It's like we have, you know, handouts to help families employ helpers, for example, and there's also government incentives for people to move close to grandparents. So that childcare support piece is quite taken care of. In the US, childcare support is like, you know, zero, and it's so expensive. So over here, the government has done a good job in trying to keep childcare costs low. Where I've heard a lot of the challenge is the education system. I spoke with someone from Moms at Work, which helps women to go back to work after they take a break. And she said in Singapore, a lot of the women who come to their organization are women who have children going through the big primary school leaving examination because they take time off to support their kids. And that's a very unique Singapore culture, right? So these are more mature women in, you know, maybe senior level positions. So it's less of it's a different kind of problem compared to if you're early in your career. And so you need different support pieces at different places. She talked about also in Japan, where there is also just a lot of cultural expectation on the woman to be 100% at home. So where do they need support to try to, you know, plug in those gaps? I think that's the question to ask in each context. Yeah.
Mm-hmm. Mm-hmm. Thank you. Do we have more questions? Yeah, sure.
Hi, thanks for those fruitful sharing. My name is Nicole. I'm currently an MPB student at LKY. And my question is, since gender issues or racial issues are considered as systematic and binary, which means the beneficiaries of status quo may be underrepresented if one company or the public policy is too focusing on the gender issues. So my question would be how to tackle with this situation. How do we bring their interests together, and how do we mitigate the gap? Thank you.
Nicole, if I get your question correctly, it's about sort of bringing in the race as well as gender and other inequalities together in the whole package. Is that, or did I?
Oh, okay. So let me
Sorry.
rephrase my question. Yeah, it's a little bit complicated. So, I mean, some beneficiaries of the status quo, such as if men are dominating in the industry, and if we implement a policy that increasing women's benefits in such settings, then the men or the dominating group may feel they're underrepresented or their interest will be hurt. So that will makes them kind of like impede the implementation of such policy. So my question would be, do you think this situation do exist? And if so, how do we tackle with this? Thank you.
Yeah, that's a tough question, Nicole, as well. And I think we all experience it at different ways, and in our careers, in our workplaces, also at home. I mean, this is constant struggle thing. And as the society is evolving, the issues are evolving. And I was talking to my husband and his colleagues who are working in the private sector. It's an American company. Now they're being sued by their shareholders, saying that why are countries taking a social stand on DEI when you have to maximize shareholder value. And this is a trend we're seeing in a lot of different sort of, maybe it's starting in the US, but it probably will come. So how do we sort of balance this? And we're just having a conversation also on DEI. How far do you push that agenda till it doesn't feel that you're sort of taking rights away from a certain group and handing it over to someone else? So there's also this aspect of weaponization that we're hearing a lot of that is being done. And it's sort of that classic conflict that's happening. So do you have a very specific sort of perspective on your experience of having navigated that?
I could share a perspective, I guess. Like Nicole, you're doing MPP, right? Yeah, we must believe in evidence-based policy making.
Yes.
So I would say, like, maybe for me as a civil servant, right, like I do believe in using data to tell the narrative, to tell the story. I think it always needs to be many sides of the coin coming together. It needs to be stakeholders involved in the conversation, right? And you're absolutely right? Do male counterparts feel happy if they are like, their rights are taken away as a result of equality, right? I mean, this is not an easy conversation, but what does the narrative say, right? Like, I think when I say data, I do believe in quantitative and qualitative. I think like stats matter, economic value matter, but the narratives of like people going through the issues matter as well. So how do we bring all these different perspectives together to make a collective decision? I think at the end of the day, if one part of the puzzle is not pulling or pushing, I don't think it will work as a whole. Yeah.
Excellent, Dennis. Ruvani, Sarah, do you have?
No, other than to say, like, it's a hard conversation. I've had conversations with several friends who feel that they've been passed up for promotions because of the quotas that are implemented in the workplace, and a woman who's equally qualified as them ended up getting the position just because. So it's a hard thing to deal with and grapple with. I think the approach that Sarah described earlier, how when she saw that, okay, for every one application I'm getting in, you get 5 males, but making a very conscious effort to solicit those extra, those applications from women, and then selecting based on meritocracy, like the best qualified from that. Hopefully you try to overcome some of these issues later on, because if everybody knows going in that they were all qualified, they didn't get in because of a quota, you try to address some of those, but I don't have a perfect answer.
Yeah, my mind goes to data as well. I think in my previous company, I was working in a value-based care company, a company that was supporting value-based care, and that is kind of opposed to fee for service, right? So pay for your healthcare versus get paid to not be in the hospital. Like that itself is a conflict, right? Doctors get paid because there are people in the hospital. If there are no people in the hospital, so there's this insidious kind of incentives, right? And I guess it's similar in the principle in that there's just a kind of competing of different incentives, and how we bridge that gap by trying to get the doctors to purchase products to support a kind of model that would essentially kind of undermine them was to show the data that, hey, if you actually do this, you actually have, you gain certain amount, even though you lose certain amount, but ultimately you gain more, right? So that's the story that we had to put across the data to be able to convince folks on the cognitive level. But then again, there's always the, whether you feel that you want to do that, because sometimes we have the biggest data that, eating a burger is not good for you, but we still do it. So there's the data, but there's also your own convictions there.
Yeah. Yeah, and that's a very interesting thing, and we've been thinking about it a lot, and personally me as well recently. As a woman of color, do I also want to advance my career? Would I be seen advancing in my career because there is that perceived privilege or quota for a certain group? And constantly I feel that's not the benefit or advantage that I want to be associated with. So it's a very tough, it's a tough question, and I think it's an evolution of society and context with instruments in public policy data coming into sort of play. So, but thanks for the question, Nicole. It was very, thoughtful. Anyone else? Do we have? Yeah, sure, please.
Hello. My name is Joe. I'm alumni of LKY 2004. Every organization, whether it be public institutions, private sector, or NGO, you have an objective missions to deliver. And every player in those organizations are important. They have talent and abilities to contribute to the final outcome for the benefit of the society. And in your experiences, do you think leadership is important in those organizations to make sure whoever is in authority recognizes your unique potential, experience, and ability and give you that opportunity to deliver? Or you at times experience other factors that come into play that do not give you that opportunity to deliver in those organizations? I'll give you an example of my own management. There is a contextual perspective coming from a developing nation like my country, and your experiences are more towards a developed economy. I was head of a state-owned enterprise. I realized that I have an agenda to deliver product for the state-owned company. And what I was looking for was potential experience and talent. I do not look at other factors. I do not look at whether you be a male, female, or you from this region or that region. No, I really look at towards a person. I look at ability and say, if I appointed this person, yes, she's got a weakness or he's got some weaknesses there, but I saw a huge potential. So I redesigned the job descriptions to make sure that I utilize that potential to deliver what I want in an organization and to appoint that person to that position. Now, as a result of that, I employed a good number of female in a state-owned enterprise. And we deliver. I raised the profile of that company from about 80 80 million in our currency to 200 million. So the point here is basically to say that irrespective leadership in any organization in promoting everyone at equal footing must have the ability. If you have it, you need to be given opportunity to deliver. So in your experience, what do you see? What are impeding factors? What are the potentials that you possess, you believe you need to be recognized? But if not recognized, then what are those inhibiting factors contributing to progress? Thank you.
Does anyone want to? Yeah.
You paraphrase. So what are the factors that help bring the success for ourselves or for the organization?
Organization.
I suppose like what are the factors that allows each of us to maximize our potential, right?
Do you want to?
Yeah, maybe I could give it a shot at it. Maybe it's like the way I might think about it is like at the micro, meso, and macro level. I think leadership is very, very important in an organization to set the culture and the norms of the organization. And like, you know, I congratulate you for like really seeing beyond gender roles in the context that you're in. I think that's important, right? It's leadership courage that would, I think, make a lot of difference in the success of the individuals and the success of the company. But I suppose there are, to me, a couple of other key factors that might be at play, right? You have like, I personally feel like the middle layer in many organizations are like the heartbeat of the org, right? Like there's the top layers who might be the board members or who might be your management leaders, and they set the tone of voice. But when it comes down and percolates down, right, that culture or that policy would be implemented by your middle layer. And this could be like your managers or like your, you know, -1 below you, right? And how then do you give them enough empowerment? How do you get them trained up to a level? How do you inculcate the values that the leaders might have to that level? I think that's critical, the way that I've experienced it. And then that's down to like the individual level, right? Like, does the context or like, are there enough policies and support system put in place to allow individuals to speak up and to like perform to the maximum of their potential? I think then it's two factors, right? There's always going to be the push and pull factor, right? You've got to be enabled to do the best in your job, but I think as individuals, I'm for a proponent of like us needing to take that step forward, right? That personal courage, I think is important. Then how do we build it in females? Like we tend to have this, like, you know, questioning ourselves a lot more than males, I think. I think that's just how genetically we are made up. Like we question our decision. We want to do the best for everyone, but I mean, that sometimes is a detriment to like progress in the workplace, right? So then how do we manage what we feel might be the norm, right? How do we get out of some of this mental model? I think that's at the individual level. So I suppose from my perspective, there are many factors that might influence or allow each individual to perform the best at the workplace.
Yeah. I mean, I think it's so multi-layered to how do we make everyone produce their best work. Yeah, there's like these structural pieces. I guess I'm thinking about it from a more psychological sense where there are different generations as well and what is important to each generation. You know, our older parents were more into stability, I suppose, security. But what I understand of younger generations right now is maybe they want flexibility more. So get to maybe the heart of perhaps, where each so-called generation it needs to be motivated. For mine, I think millennials, I heard like purpose is a big thing. Like, they do these surveys and people always write about what is important. And you just see these different trends. So I guess being on top of where, the new workers who are coming in and what they value is also another way to think about how to motivate folks to do their best work.
Ravani, do you have something to add? Or?
I guess just one thing I'll mention. So having your leadership as an ally, as everyone has talked about, is critical. Just observations from working in South and Southeast Asia now for the last 2 years, I find there are sometimes cultural aspects that can sometimes be a little limiting based on either how individuals are raised, or in the workplace, what I've seen in some countries is some junior employees are very deferential to their senior leadership. And so even if they have a good idea, it's not heard because of the culture in which they're working in. And I'm not saying that this is a positive or a negative. I'm just saying that you have to understand what you're working within. And you have to be acutely aware when you're trying to address some of these issues, like how you pull someone up. Because in some cultures that might be needed, where leadership is, it is necessary that leadership is pulling you up. And it's harder to voice your own opinion. And then there are situations that you can create in the workplace because of that context to encourage people to speak up more and voice their ideas a little bit more. So just based on the observation, and also like as a South Asian myself, I grew up in a culture where you do not challenge authority. And that took me a long time to overcome that mental barrier that I put for myself when in the workplace. And yeah, so I think there are cultural nuances to how things operate in the workplace, and so you have to work within those confines sometimes.
That's super helpful. I mean, and just sort of, and because I'm just coming out of a leadership training course, I have a few models that they talked about. And I think there was this triangle where they're talking about empathy, trust, and competence. So you have to be able to balance the three well to be able to get the maximum output from your team. And as sort of type A introverted, that's my starting point is, for me, is competence. Can the team deliver? Can this person deliver? And what I was blind to was the empathy part of it. Do I understand where this person is coming from? And am I creating the right trust environment for them to be able to operate? And I think that's something that I have been learning about myself as well over sort of the past few years and months. So I think it's a constant journey from how we can get the best output. So also depends on you as a leader of the organization. What is it that you want to prioritize and how do you want to navigate? So yeah. Anyone else? Do we have more questions? Oh, good. We have a lot of interest.
Hello, I'm Vivian from China. I have been a housewife for 50 years old. Today is my last boy going to take PSLE.
Yay.
Oh, yeah. Next week, I think I'm quite free, maybe next year. So this is my questions. I think after COVID, like more and more the women or maybe the families just move to Singapore. Maybe it's because of family issues or for the personal issues. I think recently I found a lot of women just around me. There's a lot of women just stay at home, maybe look after the kids, because maybe the education or the culture or maybe more the language, they can't communicate with local people. They just stay at home. I think sometimes I'm very interesting. I ask them, "Are you feel lonely? If you are alone living in Singapore, never get out to walk, do exercise." Most of the women that say, "I'm fine. I don't feel lonely." I think your topic is a woman in healthy care. I think that maybe the healthy care not about the woman in the working or the company. I think we should be more focused on the woman in family. There are just quite numbers of women in a family. I think they maybe get the question with me. Yeah, how to show your values at home. Maybe maybe the few years they will rebuild my future. I will rework at the futures. Yeah, can you just give me some the advice? Thank you.
No, that's a very interesting perspective that you brought into the conversation. And we talk a lot about sort of in the Singapore context, aging in place and ensuring you can provide care. And you're relying a lot on this invisible effort put in mostly by women. And how do we recognize that and understand that there is an important role that they're playing in healthcare and care delivery overall? There is a massive oversight. I think the conversations are beginning, but I'm not sure as sort of there's enough attention being provided on that. So do you have any specific experience, any insights, comments on that role?
So the question is about working women supporting, women staying at home moms, and how they contribute to overall healthcare. I think the US did some study where if they quantified the amount of work that a stay-at-home mom does, it equates to about 120, 150,000 USD. So just because it's not paid, it's not that there's no value. That's one baseline that unfortunately, yeah, there's no real quantification today of getting an actual salary. But there's so much value, and congratulations that your son or daughter, your child is done with PSLE. I understand that's one of the biggest milestones for parents in Singapore. And one piece, if you're thinking about going back to work, is that kind of one of the questions that you're thinking about? Is about maybe quantifying or valuing the skill sets that have been built up during that time into something that can support with the next phase of the next act of your life, really. Yeah, what was it that some new skill sets that you did, maybe before you were a mom at home, you were doing some work, maybe you're an engineer, but then now you picked up a lot of people skills. So that's something that you need to not see as a gap, that is wasted, which is what it is in the eyes of, I guess, employers. It's really about learning how to tell a story again of what you did during that time. Maybe you were volunteering a lot. Maybe you were helping with your neighbors or the community center for stuff. There are different ways to essentially put what was done during that time into valuable things that are valuable to your next employer. So can think about being creative that way. And there are many networks as well, and organizations that help with that today. So Moms at Work is one which might want to check out. Yeah.
And I think increasingly, or not increasingly, I'm seeing a few of these things pop up on LinkedIn saying I took a break for this and these are the things that I did. And in the beginning, I would just roll my eyes and I was like, why would it go on LinkedIn? But I think increasingly it's important. It's a responsibility also on women to start highlighting the value that they created during that time. And if we don't do it, I think there will be many more other people and women like me also who would be like, and I think it needs that to change your mindset in terms of there was valuable work done, there are key lessons, there are key skills that you gained during that time. And I think that's important to bring it into the mainstream of the conversation around work. So yeah, thanks for that question as well. Anyone else has a perspective on that or not really?
Yeah, maybe I would just add a thought. I think one thing that you shared kind of, I think was quite critical, right? When you asked your friend if she felt lonely being a home carer, right? Like, and your answer was that, like, she said no, right? She was actually pretty happy in that role to some degree, right? And I don't know if it's about then the type of value that we might attach to certain roles and positions that are played in society, and how do we then, I think it's not easy to, we learned it in school, right?
Yeah.
Like, how do you quantify like the moonlighting industries, right? Like, and I think there's one thing which is looking at this at the systemic level, because Singapore is cutthroat, right? Like, they want the males and the females to go out and work. It's not a choice, right? If I had a choice, maybe I want to like work lesser as well. But I think Singapore society has progressed in a short period of time such that certain decisions are made from an economic perspective. I'm not so sure how much of it is like a personal choice. I think it's an evolution, right? But then, how then do we, for people who might make the choice of then not participating in the workforce, right? Like, what does that look like? How do we value that from a familial perspective and also from a society level? I think that's part of it. And if it's your personal choice, I feel, to like transition from home to the workplace, then definitely, as Sarah mentioned, there are things that you could do to build up your resume or to like demonstrate your interests and abilities to go back to the workforce. Yeah.
Yeah. It sort of brings it back a little bit to the reimagination of the workspace and the workplace. Like, how do we start? And do we really need to quantify all of that? Do we allow a person who doesn't want to economically participate in the society to just feel comfortable with that choice? Because I think a lot of people in our generation also have FOMO because they're not working or not economically contributing. So how, as a society, do we ensure that they feel that they were valued as well? And I think the ticker is on time. I haven't noticed. But I think all very pertinent points in conversation, not easy to resolve and answer, and I think that's why it brings us back, that we need to have these trite discussions over and over again to be able to unpack some of that and come up with practical solutions. Do we have any other questions, or are we just at time now? 0, okay, it's red. We are on time, cannot go past this now. We just want to thank all our panelists here for the very, very fruitful conversation. It was more interesting than I had initially anticipated. And also from all of you, I really appreciated the participation and the very good questions. I hope this has been useful in some way or shape to you. So thank you so much, everyone, for being here. Thanks, everyone. Thank you.
So thank you to the panelists for this session, and we may now proceed for our lunch break. The next lobby session will begin at 3:15 p.m., so you may walk around until then. In the meantime, you may also feel free to explore around our campus and participate in some of the fringe activities that we have for you, such as our research and heritage exhibitions and our amazing race, where 20 individuals may stand to walk away with about $120 worth of vouchers. There are pop-up food stations as well in our student lounge, so please feel free to visit that area as well. Thank you.